it's important that educators as well as family members and young adults consider the information that's presented in the individual healthcare plan when they're looking at educational planning. So whether it's involvement and incorporation of that information into the individual education plan, the IEP, and in looking at the IEP, that information would be included, especially in the present education levels, considering that young person's strengths and needs around healthcare issues, and then how that can be implemented as part of that year's plan for education. Also as part of the IEP is the transition plan. And when we're looking at specifically what a young person is going to do as they leave a high school setting, so as they're going on for further education, training, employment, and independent living, those healthcare considerations are crucial to consider. I've worked with a number of young folks with specific healthcare needs, such as students that had asthma or diabetes, and that really does implement both what's going to happen while they're going on to a post-secondary setting, but probably more importantly as they're looking at their employment options and considering what is that work environment going to be like once they leave school. The other area that we should really consider incorporating the individual healthcare plan is as educators are writing the summary of academic and functional performance for a student. That document, which is given to a young person as they graduate from high school, should incorporate the needs of that young person regarding their individual healthcare plan.
If children with special healthcare needs don't have an individualized health plan in school, they may not be able to attend school, they may be in danger when they're at school, they may not be able to pay attention or learn in school. And so having that individualized health plan is the single most important component of a plan that will allow them to benefit from their learning and participate in the school day. The Individuals with Disabilities Education Act, which is the federal special education law, requires schools to identify students' needs and develop a plan to address all of those needs, including academic and functional. Certainly being able to function in the school based on your special healthcare needs is an important component. So as part of the IEP, children with special healthcare needs also need an individualized health plan. One of the most important reasons an IHP is important for schools is to be able to keep children safe. If a child has a special healthcare need, such as a severe allergy, for example, and needs an EpiPen, if there's nobody in the school who could administer that EpiPen, that child could die. And not only would that be a tragedy for the child and their family, but it also would subject the school to significant liability, legal liability. And so it's also important for schools to be able to protect themselves in the case of an emergency. Of course, schools' mission is to educate all children, make sure they maximize their potential. And so an IHP helps them meet that mission for children with special healthcare needs. The first thing that has to be in an IHP is a description of the child's special healthcare needs and how those special healthcare needs impact the student's ability to be in school and to learn, to pay attention, to focus, to be safe. It also has to talk about how the school environment affects the child's special healthcare needs. So the whole plan for how you're going to make sure that the school environment is safe and welcoming for that child all have to be in the IHP. And that IHP also includes who's responsible for what training has to be provided, who's going to provide the training. This is why it's very important for the parent and the child's doctor and specialist to be involved in developing the plan, because they're the ones who really know how to address the child's needs. You also have to make sure that there is sign-off by everybody who has responsibilities in the IHP. How are you going to make sure that the teachers of this child know what's in that plan? How are you going to make sure that the student themselves knows what's in the plan and what their role is? And how are you going to make sure that the school administrator, the principal, the nurse, and others are aware of their roles and are able to carry them out? If a child is receiving special education services under IDEA, then the parent should bring information about the need for an IHP to the IEP meeting. An IHP should be a component of an IEP for a student with special health care needs. An IHP should be in writing, and parents need to be insistent that even though the student may have an IEP, the IHP is also required. Sometimes schools will take the position that an IEP only deals with academic issues, but the law is very clear that it has to deal with academic and functional areas. And a child's health is certainly an area that impacts their functioning. An IHP is just a piece of paper unless it's being implemented. And even if it's implemented, it's not very useful if people don't make sure that it is working as intended. There needs to be written into the IEP periodic revisiting, meetings. They don't have to be in person, they can be on the telephone, but periodic meetings to check in and make sure that things are working as well as they should. And of course, the parent, the teacher, the nurse, everyone in the school and at home needs to check in with the child themselves to make sure that the plan that's been put in place is being implemented and that it's working and that the child feels that they are able to attend school safely and that they can learn.
As a young person is getting ready to transition out of high school, it's important that they have a good understanding of their medical conditions, their medical needs, and how they can obtain those. So as they're moving from a pediatric to adult system, that they're aware of what needs they have, how to ask for assistance from their current doctor, how to take care of their medical needs, such as filling prescriptions, taking care of medical equipment. And again, that information which is contained in the individual healthcare plan, they should be able to follow through on, not having to rely on support people in their lives, such as their parents or other family members.
There are many resources that are available for families to help them if they believe their child needs an individualized health plan. One resource is the Family-to-Family Health Information Center. Every state has a Family-to-Family Health Information Center that's responsible for helping families who have children with special health care needs. And all of those F2Fs can provide information and support to families. And families can find out the Family-to-Family Health Information Center in their state by going to the Family Voices website at www.familyvoices.org. Every state also has at least one parent training and information center, and their job is to help parents of children with disabilities and special needs in school. And PTIs can help families advocate for an effective individualized health plan. Families can find out the PTI in their state by going to www.parentcenternetwork.org and clicking on their state on the map.